someone walking up to you and talking to you about airplanes. They go on and on and on about what color they are, his favorite kind, what kind of engines they have, how fast they can go, and you're probably wondering, why is this person talking to me, number one, and why are they telling me about airplanes? Is this person playing a joke on me? They're not. This is exactly how someone with Asperger's syndrome would act. My best friend's brother was diagnosed with Asperger's when in a later age, which is a little uncommon. And I'm interested in this topic because I want to be an elementary school education major and do special ed. I think it's important for you guys to know so you guys can be aware of the syndrome and possibly be more patient with strangers that you don't know, who you may think are strange, because they don't act this way intentionally. It's also Autism Awareness Month. So now I'm going to tell you what Asperger's syndrome is, the main features of it, and the diagnosis, treatments, and the cures. According to CANCREST, an organization that promotes autism awareness, Asperger's syndrome is the mildest and highest functioning form of autism. It's a type of pervasive development disorder, which means that there are delays in basic skills such as communication, socialization, and imagination. And according to WebMD, where I found a lot of my information, there's 2 out of every 1,000 people who have this syndrome, and it's more common in males than in females. And they're usually diagnosed between the ages 2 and 6 years old. Next, I will talk about the main features, which I found from a book called Asperger's Syndrome, a guide for parents and professionals. What I found was they have a lack of empathy, they're naive, and they have an inappropriate, one-sided interaction, just like I was talking about before with the airplanes. They have little or no ability to form friendships. They have a lot of repetitive speech. They go over what they say. And there's very poor nonverbal communication, such as hard to make eye contact, and they can't really read body language. Like when someone doesn't want to talk to them, they don't really understand, or if someone's happy or sad, they don't really understand those cues that you give off. They have intense absorption in a certain object or a subject, such as airplanes or trains or really anything. They can be obsessed with anything. And they're sometimes called mini geniuses because they know so much about their subject. They're sometimes clumsy, ill-coordinated, and they have odd postures. And now I want to show you guys a video real quick that I found with a boy who has Asperger's.
I have trouble reading people's emotions. Emotions like smiling, crying, anger. There's certain things that people do in their eyes, their nose, their mouth, their hands, their everything. I just don't see that.
29-year-old Jason Ross has Asperger's syndrome, a neurological disorder that impairs the ability to read other people's emotions, which makes relationships extremely difficult.
Is this the only one you put down?
Yeah. Okay. Since I'm Asperger's, I don't know if people like me and people don't like me. It makes me feel frustrated.
I felt that something was not quite right with Jason.
So he has Asperger's, and as you can see, it's difficult for these people to communicate and to understand people's emotions towards them. And then lastly, I'm going to talk about the diagnosis, the treatments, and cures for this. There are no actual tests to test for Asperger's disease or syndrome. Usually a parent or teacher will see these main features that I explained before and think that they were odd. So they'll probably take them to their primary doctor, and their doctor will do a complete physical test and a test of their whole history before birth, and just to see what happened maybe in the womb, just whatever it may be. If there's no like physical disorder, they'll be recommended to go to a specialist in childhood development disorders. And the treatments that they'll usually give them are they'll go into special education depending on their unique needs, or they'll have behavior modification strategies, which is mostly to like praise the children, just give them positive reinforcement, say great job all the time when they do something right, whatever that may be, or speech or physical therapy. And there's no medication to treat Asperger's syndrome, and there are also no cures. But diagnosing it early really can help the integrity of the child and you down the road. In conclusion, you've learned what Asperger's syndrome is, how you can tell someone has it, and effective treatments that they use. Hopefully now you can be patient with a stranger who might come up to you and talk to you about whichever topic so you don't get frustrated. You never know, they might have Asperger's syndrome.